Good morning, sir. For today's demo, we'll be doing the nasal gastric tubing. So, this is a inserting of nasal gastric tube. This is a method of introducing through nose into stomach by inserting the nasal gastric tube. So, you are gaining access to stomach and its contents. This enables you to drain the gastric contents, decompress the stomach to obtain the specimen of the gastric contents, introduce passage into GI tract, and this will be allowed to treat gastric immobility and bowel obstruction. So the purpose is to feed the client with fluids when oral intake is not possible due to dilute and remove consume of poison, to instill the ice cold solution to control the gastric bleeding, to prevent stress secretion of the gas and relieve vomiting and extension. And here are all the materials needed. We have the kidney tray, the syringe, we have the lubricant, the cotton balls, the adhesive tape, the stethoscope, the marker, the clamp, and we have the towel, the water, and lastly, we have the nasal gastric tube in appropriate size.
Now we're going to perform the proper hand hygiene. Now we're going to wash our hands using the soap and water. Proper hygiene control the spread of microorganisms. And then we're going to rinse with clean water.
Now we're going to close the curtain and the door to ensure the client's privacy. First, we have to check the doctor's order for insertion of nasal gastric tube. This clarifies the procedure and time, the equipment required, then explain the procedure to the client. Explanation facilitate the client cooperation. Hello ma'am, good morning. My name is Princess, your caregiver for today. And we'll be doing the insertion of gastric tube on your nose so that we can feed you properly. We have to gather the equipments because organization provides the accurate skill performance. May I know your name, ma'am? And your birthday?
December 24.
Okay, thank you. Assess the client's abdomen through the assessment so you can determine the presence of bowel sound and amount of abdominal distension. So we'll be checking using the stethoscope. So mama will be checking you. Perform proper hand hygiene and wear disposable gloves. Now I'm going to wear the disposable gloves. So this is a prevent the spread of the microorganism. So we have also assessed the client's high Fowler's position over 45 degrees if unable to maintain the upright position. More natural force you into a semi-Fowler's position. Going to check the nostrils. The tube passes more easily through the nostril with the largest opening, so we have to check by checking the nearest. So now I'm going to check nostrils of the patient. So for patency, by asking the client to occlude one nostril and breath normally to the other. So we have to check the ears and your nose, inhale and exhale, and then we're going to clean it by using cotton balls. So now, ma'am, can you inhale, exhale, and then we're going to check the nearest of the client using the cotton balls. So now, ma'am, I'm going to check your nose, or clean your nose using the cotton ball. So, ma'am, I'm going to clean your nose using the cotton balls. Cut nga natin yung we have to choose the nostrils through the air which passes easily, and then we'll be doing the left side. Then measure the distance to insert by placing the tip of the tube of the client's nostrils and then extend to the earlobe, then mark tube using the marking pen. Going to measure, ma'am, using the nasal gastric tube. So from earlobe going to the nose, the tip of the nose. And then we're going to mark using the mark pen. Measurement and ensure that the tube will long enough to enter the client's tongue. Then lubricate the tip of the tube at least 1.5 inches using the water-soluble lubricant. This will reduce the friction, facilitate the passage of the tube to the stomach. So using the lubricant, we're going to put lubricant on the tip of the tube. Passage of the tube of the stomach, xylocaine jelly may not be recommended to use lubricant due to the risk of the xylocaine. Sharp water-soluble lubricant will not cause pneumonia if the tube accidentally enters the lungs. So, insert the tubing to the nostril by directing the tube down, ward margin backwards. Then, when the tube reaches the pharynx, instruct the client to touch the chin, and then encourage her to swallow, even no fluids permitted. Direction: when the client swallows, stop. When the client breathes, if clogging and coughing persists, check the placement of the tube with tongue depressor and flashlight if necessary. Keep advancing the tube until the marking reaches the point, following the normal contour of nasal passage while inserting the tube. Reduces the irritation and the glucosal, the gag reflex stimulated by the tube and swallowing. Help advance tube. Causes epiglottis to cover the opening of the trachea. Help eliminate the gagging of caffeine. The excessive coughing and gagging may occur when the tube was curled in the bathroom. Forcing may injure the mucous membrane, and the tube is not the esophagus if the client shows signs of stress and unable to speak or not. Insert the tube to the nose of the client. When you attach it to the end of the tubing and aspirate small amount of stomach contents, visualize the aspirated contents of colors and consistency for auscultation. Inject small amount of air, 10 to 15 ml, into the nasogastric tube. When you attach it to the end of the tube and aspirate small amount of stomach contents, you're going to visualize the aspirated contents, colors, consistency. For auscultation, inject small amount of air, 10 to 15 ml, into the nasal gastric tube. So now we're going to inject 10 to 15 ml. While you listen to the stethoscope, observe approximately 3 inches or 8 centimeter below sternum to obtain the geographer placement of tube ordered. Now we're going to check using the stethoscope. Tube is in the stomach. It contents can be aspirated, and also you will be able to hear the air entering and also if the tube is in the esophagus, injecting, it will be difficult and impossible. So secure the tube with tape to the client's nose and careful not to pull the tube too tight against the nose. Constant pressure tube against the skin, mucous membranes causes tissue injury. Then clamp the end of the nasal well, band the tube by fingers into opening. Bending tube prevents the inducing of secretion. So using the clamp, now we're going to put off and dispose the gloves and perform hand hygiene to prevent the spread of the microorganism. Then replace properly the disposed equipment to prepare for the next procedure. Record the date, the time, the size of the nasal gastric tube, the amount and color of drainage, aspirated, and relevant to client's reaction. Then sign the chart report to senior staff to provide continuity of the care.